The ankle is the region where the foot meets the leg. It is composed of multiple bones held together by bands of fibrous connective tissue known as ligaments. An ankle sprain, one of the most common sports injuries, occurs when one of the ligaments in the ankle region stretches more than it is able to, sometimes even causing a tear in the ligament. There are many ways that an ankle sprain could occur, but the most common is through playing a sport. People who play sports that include a lot of jumping, and therefore a high chance of stepping on someone's foot, such as basketball, volleyball, and soccer, have a higher risk of getting an ankle sprain. However, one can also get an ankle sprain by simply stepping off a curb the wrong way. Genetics also plays a role in your chances of getting an ankle sprain. If your heel naturally turns more inwards, a condition known as hindfoot varus, it is easier to turn your ankle and put strain on ligaments in the ankle region, increasing your risk for getting an ankle sprain. Treatment for ankle sprains vary based on the severity of the injury. Most of the time, if the ligament is not torn, a physician will advise an injured patient to follow self-care methods at home. This includes following the RICE protocol. RICE stands for rest, ice, compression, and elevation. The RICE protocol is designed to reduce pain and swelling, promote healing of the ligament, and restore function of the ankle. First, it is important for someone with a sprained ankle to rest the injured area for 48 to 72 hours or until the pain is minimal and tolerable. At the same time, it is important to ice the area. One should place cold ice packs in the area for 15 to 20 minutes, off for 15 minutes, on for 15 to 20 minutes, off for 15 minutes, then on for 15 to 20 minutes, and the cycle should be continued 3 times in a row and repeated 3 to 4 times a day. Also, the injured area should be gently compressed. This can be accomplished by wrapping an elastic bandage around the ankle tight enough to compress it, but not too tight where the circulation gets cut off. Lastly, it's important to elevate the injured area above the heart in order to reduce internal bleeding, if there is any. Heat can be applied after 48 hours to help increase blood flow to the injured area, in this case the ankle ligament. In some cases, a physician might advise to take a non-steroidal anti-inflammatory drug such as ibuprofen or acetaminophen to aid in the reduction of inflammation. In severe cases, when the ligament in the ankle area is torn, orthopedic surgery may be required. What usually occurs during surgery is an orthopedic surgeon replaces the torn ligament with a piece of healthy tendon, called a graft. If a sprained ankle is not treated properly, it can have serious complications. Stretched or torn ligaments that are not attended to can lead to chronic ankle instability and may cause the ankle to become weaker over time. It can also lead to further ankle injuries, since the bones of the ankle are more likely not correctly held together by the injured ligament. In addition, it is important that the treatment of a sprained ankle begins immediately after the injury occurs, as a delay in treatment could inhibit the injured ligament from healing properly. Thank you for watching. This presentation was created by Harshil Lalwani.